let's go back and review the questions for this topic on primary amenorrhea. And you were correct about that 2-year difference, but you just forgot primary is defined if there's no menses by age 14 in the absence of secondary sex characteristics, and by age 16 if there are secondary sex characteristics. So just remember 14 and 16. That was the difference in the age. And so typically the first menses should occur within 2 to 3 years after the initiation of pubertal development. So then the next question is what you ask on history and what you look for in physical exam. So things to look for on history, you mentioned the progression. Does she have a normal progression of sexual development? You actually mentioned medications, which I think is very important, and I didn't have it listed here. But especially in teenage girls, it's very important to ask about eating disorders or intense exercise. So make sure to mention that in your history. And then as far as the physical exam, I thought you did a very nice job of talking about looking at her BMI, at her habitus, looking for symptoms associated with PCOS, such as hirsutism. Of course, you're going to, when you do your general physical exam, things to look for on HENT is palpate her thyroid, make sure she doesn't have goiter or nodularity. Ask about anosmia, and then you can screen for anosmia if she mentions she has trouble smelling. On her skin findings, you mentioned hirsutism. Also look for absence of sexual hair. So if, and we'll get to that in just a moment, that's a symptom of a particular disorder. The lanugo or sallow skin typically is associated with anorexia, and acanthosis can be associated with PCOS in the insulin-resistant patients. Do your Tanner staging, do your general evaluation of cardiovascular. On abdominal exam, you're feeling for masses, and you mentioned if somebody has a hematometria from either an imperforate hymen or a transverse vaginal septum, you can feel that on abdominal exam. When you do your pelvic exam, does she have pubic hair? That's a tip-off, and I'll tell you what that is in just a second. And then, again, look to see if she has a vaginal canal. Can you see a cervix or not? That's very telling.